Welcome to the presentation for individual consulting, created for Psych 847, Liberty University Online. My name is Constance Mitchell. I am an industrial organizational psychology doctoral student at Liberty University. These are the 4 chapters and topics that I will be presenting today. The first topic is from Chapter 16 of Module 5, on the proactive ways to improve leadership performance, specifically addressing the contingency model of leadership. The second topic is from Chapter 22 of Module 6 on the cross-cultural issues in international organizational consultation, addressing multiculturalism in organized psychology. The third topic is from Chapter 23 of Module 7, which involves consulting with healthcare organizations, specifically addressing the various forms and integration of healthcare systems. The final topic is from Chapter 28 of Module 8, which highlights understanding organizational performance and processes, addressing the design and execution of performance management systems. Let's get started with the first topic from Chapter 16 of Module 5, addressing Fiedler's contingency model of leadership. Research has shown that a leader's characteristics alone are inadequate to predict effectiveness in the workplace. Consequently, organizational consultants should factor in situational characteristics, personality attributes, and intelligence. Empirical research has been conducted to identify leaders who have the potential to be highly effective, but according to Lohman's study, it is still difficult to identify the exact leadership traits and personal attributes that distinguish high-performing leaders. An Ox 2018 study confirmed the absence of a systematic approach representing the framework for effective leadership. Fiedler's 1967 and 1993 studies on the contingency model of leadership, or CML, was one of the first theories to suggest a positive correlation between leadership performance and certain traits and personal attributes of leaders. The CML's most prominent personality measure is the least preferred coworker, or LPC score, which assesses whether the leader is more people or team focused or more task centered. PSYC8 and others' 2012 research extended the biological basis for Fiedler's contingency model of leadership by explaining the interaction between leaders' biologically based facial traits, the contents of the leader's message, and the social environment of the group interaction. The results of the author's study suggested that leaders whose facial features were more masculine were most preferred when a message of a group competition was needed, versus the preference of feminine features when a message of a group cooperation was needed. The study conducted by Miller and others in 2004 extended Fiedler's contingency model of leadership to fellowship behavior and effectiveness. This study assessed the relationship between the motivational disposition of followers, situational favorability, and followers' job performance. The results show that motivational disposition, situational favorability, and job performance generalize to the behavior of the followers. Ox 2018 study focused on the contextual influences of leadership, such as institutional forces and crises that impact the leader's processes and outcomes. The biblical reference that is appropriate for this segment on improving at leadership performance comes from Acts chapter 6, verse 3. The 12 disciples urged the bigger group of the disciples to choose 7 men who were known for having a great reputation and wisdom to become their leaders. Now let's move on to the second topic from Module 6, addressing organized psychology and multiculturalism. The American Psychological Association, or APA, has imminent concerns about organizational psychologists beginning to prepare for multicultural assignments. APA took 3 important steps to respond to the evolving multicultural psychological setting. They first developed the standards for providers of psychological services to linguistic, culturally diverse, and ethnic populations. The second important initiative included 2 national multicultural summits that 3 of the APA's divisions sponsored in January of 1999 and February of 2001. The third major APA initiative is still in process, and it is being pursued by 3 of APA's divisions. Hoffman's 2016 study conducted in the United States examined the historical state, present state, and future state of multiculturalism, which is diverse ethnic groups and/or cultures within a society, and humanistic psychology, which is looking at the whole person. This study focused on 3 culturally diverse topics the author researched during his tenure at the Society for Humanistic Psychology, where he served as the president. The first topic discussed the perspective of humanistic psychology and the value it places on cultural diversity. The second topic suggested that humanistic psychology has a lot to contribute to the development in multicultural psychology by advancing theory, conceptualizations, and furthering research on issues of diversity. The third and final topic suggested that humanistic psychology has great potential to evolve through dialogue about multicultural issues to enhance its relevance and ability to positively impact the world. Johnston's 2015 article evaluated the multicultural issues in globalized and progressively diverse settings based on the reactions of clinical psychologists in South Africa. Traditional barriers that once separated individuals in society are disappearing, and there's more of a cultural exchange of immigration, ideas, information, and trade. Although the multicultural training and experiences of clinicians working in diverse settings have been recorded in other parts of the globe, there's been very little documentation in South Africa. Johnston's 2015 study noted a need for more research to examine how clinical psychologists reconcile multicultural issues at the level of their daily supervisory and clinical practice. McConnell and others study noted that although the intensity level of intergroup conflict, hatred, and violence has been on the rise, local and national communities are continuing to become more diverse and multicultural. These authors contended that multiculturalism, social justice, and peace are important components of a Christian worldview, and they suggested that Christian psychologists should demonstrate these salt and light characteristics despite modern-day impediments. The biblical reference that is appropriate for this segment on cross-cultural issues in international organization comes from the book of James, which reminds us that favoritism based on race, ethnicity, socioeconomic status, etc., is forbidden. The Word of God says that when we discriminate, we have become judges with evil thoughts. The third topic is from Module 7, which focuses on the various forms and issues of integrated healthcare systems. The United States healthcare industry encompasses a wide and diverse selection of entities and enterprises, including hospital organizations, insurance companies, physician groups, and specialty care providers. Historically, these different sectors have operated independently of one another, but now they are becoming more and more interconnected to adapt to the radically changing healthcare landscape. The three main categories of integrated healthcare systems are managed care organizations, or MCOs, which include health maintenance organizations, or HMOs. The second category includes physicians and hospitals that together form a partnership known as the Physician Hospital Organization, or PHO. The third category is IPAs, which are legal entities consisting of physicians who practice independently. Hantix and others' 2019 research was conducted to examine previous studies that evaluated and implemented cultural competence interventions in healthcare facilities. The impetus for this research was the knowledge the authors had about the language barriers, differences in health beliefs, and legal restrictions that limited access to healthcare services for patients who were culturally and linguistically diverse. The authors identified 4 groups of culturally competent linguistic and cultural healthcare strategies that resulted from the studies they observed. These 4 groups included factors at the individual level, the organizational level, strategies to develop and implement healthcare that is culturally competent, and policies that provided accessibility to culturally competent healthcare. The qualitative research results showed the strategies and factors of culturally competent healthcare were valued by the providers and patients and considered significant. However, the overall impact on the utilization rates of specific strategies and components and patient outcomes were not significant. Shin and others' 2018 research addressed the racial disparities that exist in healthcare environments. The authors noted the existing data regarding racial disparities in the United States healthcare system between white and Black patients. Previous research showed that Black patients received poor quality of care than did white patients on a consistent basis, according to the National Center for Health Statistics. A report issued by the Institute of Medicine noted that circumstances such as socioeconomic status, health insurance status, patients' preferences, and access to health care are all contributors to these disparities, but they do not fully explain them. The study underscored the importance of training patients and physicians to engage in participative conversation to overcome these ethnic and racial barriers. Zussman and Regan's 2013 study discussed impending concerns about healthcare reform. Healthcare stakeholders have had to pivot and find innovative ways to provide care because of imposed brakes on federal healthcare expenses and excessive healthcare related costs. As a result, many hospitals are partnering with other healthcare institutions to remain financially and strategically successful. The new integrated healthcare model combines physician groups with hospitals, insurance companies, and other medical providers. They use sophisticated technology to collect and analyze data that encourages preventive care and provides efficient and cost-effective health care delivery, and management. The biblical reference that is appropriate for this segment on healthcare is 1 Corinthians 6:19 through 20. The healthcare system exists to provide services for the edification and well-being of our bodies, mentally and physically. Paul reminds us in these scriptures that our bodies are the temple of the Holy Spirit and that we are to honor God with our bodies by taking care of our bodies. The final topic is from Module 8, which highlights the design and execution of performance management systems. The Continuous Improvement Model, or CIM, for consulting psychologists focuses on the production and management functions of an organization. The CIM provides a roadmap for consulting psychologists that is based on scientific evidence and organizational theory that encapsulates the goals of the psychologist or practitioner's approach to coaching and consulting. The design and execution of an organization's performance management system are created to encourage and motivate above and beyond employee behavior and job performance. However, the organization's strategic plan is the ultimate driver for the performance management system because its design includes the behavior and the performance necessary from the organization and the employees to ensure the organization's overall success. The Kramer's 2013 study examined the relationship between the features of an employee performance management system for higher education institutions and the perceived satisfaction of 589 university employees. The study revealed that an increase in employee satisfaction with the performance management system correlated with tighter control and a perception of positive two-way communication. Klaus and others' 2009 study surveyed the evolving literature on employee performance management systems from an international academic viewpoint, but the findings of Klaus' academic research revealed that most of the performance management studies across international borders either lacked sound theoretical context or their hypothetical framework was loosely connected, if not totally disconnected. The author suggested that implementation of exploratory research design instead of explanatory research should be adopted for the atheoretical nature of international performance management empirical research. Guinness and Pierce 2008 study described the employee performance management process as a continuous measure of recognizing and developing individual and group performance to create alignment with the organization's overall strategic goals. This study discussed a gap that exists between the science and the practice of organizational behavior, or OB, because many practitioners have ignored valuable scholarly knowledge regarding performance management practices and their application to OB. Guinness and Pierce noted that when organizations have systematic and formal performance management processes, they outperform their competitors by 51% concerning financial outcomes and by 41% concerning employee retention, customer satisfaction, and other important organizational metrics. The biblical references that are appropriate for this segment on organizational performance and processes and performance management systems begin with 1 Corinthians 14:40. The performance management system is an integrated process designed with the best interest of the employee and organization in mind. This process, according to 1 Corinthians 14:40, should be executed and organized in a productive manner. The second biblical reference from Habakkuk 2 and 2 reminds us that we are to write down the vision, the idea, the concept in a way that we have a clear understanding and can execute accordingly. These 4 topics are appropriate for application in today's organizational setting, whether a practitioner is consulting in a healthcare environment, corporate setting, an academic setting, locally or internationally, or within the private or public sectors. This concludes my presentation on individual consulting. Thank you.